The next thing that should be there is corpse carriage or dead body carriage. So there are usually in KPK, I don't remember seeing specific or specialized carriers for the dead bodies. In most of the tertiary hospitals in the KPK, they use simple stretchers. In the same stretcher they use for the patients they also use for the corpse of the dead body. But things should not be like that. From outside the hospital, the dead body should be brought in a closed corpse carrier. Sorry, there should be a closed corpse carrier, and here is a picture of that. There should be a closed dead body carrier especially designed for the corpse. And when coming from within the hospital, the dead body should be transported on a specially designed steel stretcher having a lid. Okay, so when you are bringing it from outside, there should be a completely closed container. But if you are just transferring the body from one place to another inside the hospital, so you need a container which has a lid. These are not very high concept, but that's what your reference books think that you should know. And the body should not be directly placed on top of the carrier. So there should be no direct carrier body contact. In more sophisticated term, you can say that carrier body contact should be avoided. And why is that? Because the body might adhere or might stick to the carrier. Because it's stainless steel and the body is dead, any magic can happen. I don't know. I do not have much experience, but I don't know why I seem to find it unlikely. But your books have mentioned that the body might stick to the carrier. So you should place a piece of cloth, and they have mentioned linen, that you should place linen between the body and the carrier to avoid this adherence. So that's all about the corpse carriage. The next thing is autopsy table. There are two types of autopsy tables. There is a metallic type, which is kind of more sophisticated, and if it's more sophisticated, obviously it will be hard to buy it, so requires more money. And there is a porcelain autopsy table, but I don't think a porcelain table will be anywhere in any college of the KPK. Why is that? Because metallics, although metallic tables are require more money, but they are preferred. And why is that? Because it has a preferred advantage of having a sink, a bath-like arrangement around the table, so it makes washing easier. And I will show you a picture of that. Here is the picture. You see the table is metallic, and at the end of the table there is this sink, this washing arrangement. So this makes things easier for the forensic pathologists. And as we all know, forensic pathologists are kind of lazy people like me. I don't know. I think someday I might end up like some forensic pathologist. Anyhow, moving on to the lighting system. The lights should be adequate. I don't think that's thing I should tell you, because obviously if you cannot differentiate between the shades of color, or the maybe the kidney and the heart, so what's the point of performing an autopsy in the first place? So there should be adequate light. Instruments, all the necessary instruments. I have provided some pictures in the coming slides. All the necessary instruments should be present. Otherwise, the task might get harder for the forensic pathologist. While I'm using this forensic pathologist term again and again, but that is the ideal protocol, that a person trained in forensic should perform the autopsy, but that's not how it happens here. So any non-trained medical doctor, any with a registered medical certification, can perform the autopsy. I think you should bear that in mind. The next thing is washing. Well, if you can't wash, so things might get nastier. I don't know, smellier, and and the chances for like sepsis might increase. So there should be a thorough washing after every autopsy. The water supply should be abundant, and ideally the water should come from the ceiling. And sterilization of autopsy room should be done by ultraviolet light. So two high yields from this bullet point. Water should come from ceiling. So if it comes from ceiling, it's going to wash down everything on the walls, on the floor, except the roof. So last I heard, forensic pathologists did not like performing autopsies on the roof. And the next high yield is that sterilization. There is no sterilization specifically designed for the mortuary. Why? Because can you sterilize a room in an autoclave? I find it unlikely. So you have to do the sterilization using natural ultraviolet light. So there should be some venting or windows, etc., to allow the natural sunlight in a beautiful hazy cloudy day. So this might make things a little more comfortable for the poor forensic pathologist who is working here all day with the dead body. The next thing is ventilation. The ventilation should be adequate, and air should also, like water, the air should enter from the ceiling and leave through the vents in the wall near the floor. Such arrangements reduce the smell and prevent the transmission of infections such as any infections and that is transmitted aerosol. So inhalation related infections can be prevented with proper ventilation, and smelly environment can be avoided with proper ventilation. So moving through these bullet points once again, mortuary refrigeration units. Here is a picture of that. Mortuary refrigeration, this consists of multiple doored units, and another high yield that I did not a high yield, but another point that I did not go through previously is the concept of a hydraulic lift. It is a hydraulic lift, and what is this used for? Is used for place the body here and use this pump again and again, so it will raise this structure to this level or any level that is suitable for placing the body inside this high from ground refrigeration unit. And the high yield for refrigeration unit was you do not need to store it below 4 degrees centigrade. Another thing is corpse carriage. Corpse carriage requires closed containers. And autopsy table. Autopsy table, there are two types, metallic and porcelain. Metallic is preferred because it has this washing arrangement around it. And lighting system, there should be adequate light, and the instrument, all the instruments should be present, like scalpels, knives, chisels, I don't know, anything that you can imagine. That's not a very high yield topic anyway. Washing should be adequate, and washing should come from the water should come from the ceiling, and ventilation should be adequate. Why? Because ventilation prevents aerosol infections. So here is a picture of carrier, corpse carrier or dead body carrier. Here is another type of carrier that we have used and seen lots of them lately in the COVID. So what are these? The dead body should be covered. The dead should be enclosed in a plastic air-proof body bag, and this body bag is fitted with a zipper. You can see this is nylon zipper. So the dead body is closed in a air-proof plastic bag, and there is also a nylon zipper, and it is labeled with a warning sticker of a red color, and then this thing is placed in the refrigerator perhaps. And when is this plastic bag used? When the body is contaminated and there is potential of transmitting infection, like in case of COVID. In COVID, we use these air-proof body bags a lot. And this is the mortuary refrigeration, and here is the hydraulic lift. And this is in mortuary autopsy room, and these are all the instruments. You need not to remember them except the ones that your senior tell you about secretly that your forensic sir is going to place in the auspice stations. Yes, that's what you should worry about. Protocols of medical legal autopsy. Obviously, if there's a term legal in it, it requires protocol, it requires paperwork, and it requires gas banana है इसी बात से. So what are the formalities? The formalities are that all the paperwork should be done before the autopsy, and paperwork. So the paperwork consists of two registers. There is a general register and there is an autopsy register. There are five columns in the general register and 5 columns in the autopsy register. I seem it unlikely to appear in the examination, but I see none of the books has missed that, so it would be nice if you bear that in mind too. The columns of the general register are 5 as DNND, and that is, I think that might help you remember it. Why? Because DNN more likely sound like CNN, so I don't know if you can find a better mnemonic. Kindly and inform me too. S, D, N, and D. What is S? What does the S mean? S means serial number. D is for date and time. N is for name and identity thing of the deceased. And the next N is for name and identity of the police constable that has brought the body, or that has came along the body. And the last D is about the date again. So why are there 2 dates? I am thinking, well, there's no rocket science at all. The first date is for the date of arrival, and the second date is for date of the date of delivery, or when the body is like given back to the relatives. So that's all about the columns of the general register. S, D, N, and D. S is for serial number. D is for date and time. The first N is for name of the deceased, or the name of the dead body, and name of the police constable. And the last D is for date of delivery. Date of delivery of cops. Date of delivery kind of sounds another bell in some other quarter of the mind. Anyhow, and that's all about the general register. There is an autopsy register column, and its column are Y and C. Y and C, it's kind of hard to remember, right? So why don't you place a big heart in between? Y loves C. Do you remember any name that starts with Y? Yes, Yasir perhaps. And C? Well, I don't remember any C alphabet name people. So that is a love story that is never going to happen, because we do not see a lot of C name people. So that's why it is in the autopsy register. If there was a real love story going on somewhere, so they would be alive and happy somewhere in a Californian beach perhaps. But since there is no C, so Y has died and taken C along. The तमन्ना सीने में रख के फोर्थ हो गया. Y is for yearly number, i.e. in this year what is the number of case that this one is. यानी साल में अगर 200 केस आए हैं तो एक 201वां जो होगा 201st वन, उसके साथ हम लिखेंगे कि 201st / year लिख देंगे 2021. A is for autopsy number, N is for name and other details about the dead body. The D is for details of the specimens collected, details of the specimens collected and the laboratory to where they are sent. And the last one is conclusions about the provisional diagnosis that has come that has occurred to the doctor or the performer of the autopsy. That's all about the protocols of medical legal autopsy, and that's